Hello everyone, I'm Charu, physiotherapist working in musculoskeletal and women health area. I am trying to create some resources to help my clients understand how physios can help when they are going through any pelvic floor related issues. I completely understand that it's quite complex to know and understand the area which you can't see, but you have to imagine when you're doing any sort of pelvic floor exercises. To make it very easy and comprehensible, I have decided to create some resources which would be a bite-sized, easy to absorb kind of information. In this video, I'm going to talk about urine incontinence. The most important thing before we go ahead with finding a treatment for any of our problems, we need to know what's the root cause behind that problem. And to know the root cause, we need to understand how one problem is different to other. So let's say you are having the symptoms of when you cough, sneeze, or stand up from the chair or do any kind of movement when you're trying to lift your baby, you feel like you are going to leak or you end up leaking. Even a small coin-sized leak is there, or you lose, it could be a small coin-sized leak, or you lose the full control. So that is known as stress incontinence. So how physio can help you here in a stress continence? You need to see a physio. They can do your thorough assessment, which might include internal exam, or if you're hesitant to go ahead with internal exam, there are real-time ultrasound available which they can use to examine your pelvic floor health. When you're going through stress incontinence, what is basically happening is our bladder. So this is our bladder. So it's more of the pressure distribution issue. So when you cough, sneeze, or when you do any activity, what happens is the pressure is coming down to your bladder from the abdomen, and it's not getting equally transferred to the closure part here, which is your ureter, which needs to stay closed when there is a sudden buildup of pressure at the top. So if there is a difference in this pressure transfer, that can lead to sudden sense of weeing or a small leak when you're doing any activity. It looks very simple, but it has a lot of factors involved to get you to the right treatment. I know you all might have heard about Kegels. Kegel is a very useful exercise, but it's not a one-fit solution for every single pelvic health problem. Even with stress incontinence, it's always good to see a pelvic floor physio who is trained to assess you, as I said before, and then give you the right diagnosis, finds the right issue, and then creates a treatment plan and give you some exercises to help you with stress urinary incontinence. If you know someone who can get any benefit from this, please feel free to subscribe and share with your friends and family.